For most of human history, sickness was a terrifying mystery. Because people didn't understand why diseases occurred, they often viewed them as unexplainable divine curses with no known cures. When someone fell ill, checking their condition was a matter of guesswork. A parent might touch a forehead to see if it felt warm, but that couldn't provide the precise, actionable information needed to track a fever's actual severity. That changed when Daniel Gabriel Fahrenheit invented the clinical thermometer. This tool finally allowed humans to measure and track body temperature in degrees, replacing subjective touch with hard data. Quantifying a symptom with a thermometer was a specific step in moving medicine away from superstition. It established the first modern medical pillar, diagnosis. To diagnose what was happening inside the chest, René Laennec invented the stethoscope. These early wooden, trumpet-like instruments allowed doctors to listen directly to the internal sounds of a patient's heart and breathing to identify ailments. Zacharias Jansen's invention of the microscope revealed a landscape previously invisible to the human eye. By magnifying tiny objects, it allowed scientists to see the specific microscopic germs that were actually causing these sicknesses. Eventually, we learned to see through human tissue itself. Early X-ray machines, like the one this patient is standing before, allowed medical operators to photograph internal bone and organ defects without the need for surgery. Those early flat images led to the advanced technology we use today, like this modern MRI. These scanners, along with CAT and ultrasound machines, produce highly detailed cross-sectional maps of our internal anatomy. But mapping a patient's internal anatomy and identifying a germ only tells you what the problem is. Mastering diagnosis does not by itself stop the disease. Before the mid-19th century, physically cutting open the body to repair a diagnosed problem was a lethal gamble. Without a way to manage pain, surgery was a source of pure agony. The first hurdle was the introduction of chloroform in 1847. As the first major anesthetic, it rendered patients unconscious, giving doctors the time they needed to perform successful operations. Yet a deadly paradox remained. Look at the crowded, unsterile conditions in this historical theater. Even after a successful surgery, patients frequently died days later from severe infections festering in their wounds. This surgeon, Joseph Lister, realized that germs in the air and on instruments were the cause. He began spraying carbolic acid and washing his hands and tools, discovering the first antiseptic to kill germs before they could infect a patient. Anesthetics and antiseptics meant hospitals were no longer sites of inevitable infection, but places where physical treatment could succeed. While antiseptics clean the outside of the body, internal bacterial infections like tuberculosis and cholera required a different kind of weapon, one that could circulate through the blood. In 1928, Alexander Fleming, seen here at his laboratory bench, accidentally discovered a mold that would become our first true antibiotic, penicillin. This mold, shown here growing in a petri dish, produced a chemical that actively inhibited the growth of bacteria without harming the patient. Once the world learned to mass-produce it, as seen in this factory assembly line, humanity finally had a way to cure systemic bacterial infections on a global scale. Antibiotics gave us an internal weapon against germs, completing the second pillar of modern medicine, treatment. While treating an active disease is a triumph, the ultimate medical victory is engineering the body to never get sick in the first place. In 1796, Edward Jenner injected a young boy with cowpox germs, which were relatively mild. Weeks later, he exposed the boy to the deadly smallpox virus, but the boy stayed healthy. This was the first vaccine. As recorded in official documents like this Compulsory Vaccination Act, vaccines shifted medicine by pre-training the human immune system. Populations were eventually required to receive this care, with vaccination dates systematically tracked to wipe out viruses entirely. Prevention also moved into our environment. Louis Pasteur, seen here, developed pasteurization, the process of boiling and rapidly cooling milk and water to kill pathogens before they ever reach a human. Large-scale prevention methods like vaccines and pasteurization drastically reduced global mortality rates and extended the average human life. We inherit these medical tools, but having them isn't enough. We have to actively maintain our own health to make them effective. Daily hygiene, like bathing and brushing your teeth twice a day, is simply the individual application of Lister's antiseptic principles. Eating nutritious food, exercising, and keeping your environment clean are the daily routines required to maintain the immune defenses that Pasteur and Jenner identified. And when preventative habits fail, you must seek out a doctor to utilize the diagnostic and treatment tools developed over the last few centuries. Medical science gave us the opportunity to live longer, healthier lives, but that health is built on the daily practice of 3 pillars: diagnose, treat, and prevent.